Good evening, friends. I am Dr. Puri, Chief of Gastroenterology at GB Pant Hospital, New Delhi. At the APTW, we have with us today Professor Kentaro Sugano from GH University, and we will be discussing upper GI malignancies. So, Professor Kentaro Sugano, welcome.
Thank you.
As you know, that the GI malignancies are rising practically all over the world, and India is no exception. We have two important malignancies in the upper GI tract, basically the esophagus and the stomach. And Professor Kentaro is now going to tell us something about what the situation is in Japan, and I'll chip in and how it's different from India.
Thank you very much for a kind introduction to me and give me a chance to talk to you. Esophageal cancer and stomach cancer is the two major cancers in Japan. However, gastric cancer is much higher than compared to the esophageal cancer. And esophageal cancer kills Japanese people about 10,000 every year, whereas gastric cancer deaths is about 5 times more.
Oh.
So the gastric cancer is the biggest issue in Japan. Of course, nowadays colorectal cancer are rising up, but today's talk is not touch upon the lower GI and the focus on the upper GI. So the esophageal cancer is caused mostly by alcohol drinking and also smoking. And these days, smoking rate is declining quite a lot because of the prices hiking up. And people are aware of the risk of smoking. And then the alcohol drinking was very popular in Japan because of social drinking is a custom. But these days, more individualized way of lifestyle, that custom is declining as well. So the alcohol consumption in Japan is also declining. And many patients with esophageal cancer are partly deficient in metabolizing alcohol dehydrogenase deficiency. That causes alcohol flushing. About 50 Japanese patients are flushers.
Okay.
And those are highest risk if they smoke.
Mm-hmm.
So if alcohol drinking, alcohol consumption declining, so those risks also decline. So the esophageal cancer, especially squamous cell cancer rate, is a little bit declining because of the custom changes. And also some food are protective.
Mm-hmm.
But nevertheless, still on the fifth, probably the most common cancer in Japan. And for Barrett type adenocarcinoma is rising slowly, but only 1 or 2% of total esophageal cancer. So the situation is quite different from Western countries, where about 50% are Barrett type of adenocarcinoma.
The situation in India is somewhat different because the squamous cell carcinoma, you mentioned about smoking and you mentioned about alcohol. Those two factors are very much there.
Mm-hmm.
In addition, in India, we chew tobacco, so you put it in your mouth.
Oh, I see.
Now that is another very high risk factor for development of esophageal cancer. And as you said, we are different from the West. So in my hospital, I would see 80% of squamous cell and only 20% of Barrett's or adenocarcinoma. So that's very different from the West, where they don't see. And it's not that people don't smoke in the West, but maybe the additional factor of
alcohol in metabolism.
That's right. I wanted to ask you specifically, Japan had been one of the countries which had the highest incidence of gastric carcinoma maybe 30, 40 years ago.
Yes.
And what has happened that now that you're able to bring it down? I mean, that is a major thing that has happened in the last maybe 3 decades or 4 decades or so. So could you please enlighten us as to how you managed to do that? First, I want you to tell us, why do you think Japan had such a high incidence of gastric cancer as compared to anywhere else in the world?
Okay. During the war, World War II and before, the hygiene status in Japan was pretty bad, and water system is not complete, and also solid systems are not complete. And after World War, we had a severe defeat, and then after a while, it took a time to recover it. And then those sanitary conditions are improving, and also we are eating a lot more fresh vegetables and fruits, and the refrigeration system, like refrigerators, are everywhere now, about 50, 60 years ago. So those changes in the social lifestyle improved a lot of food consumption in a healthy way. For example, we don't have to use a lot of salt to keep the vegetables in a fresh state or unrotten state. So the salt consumption is declining, and also antagonistic vitamin C enriched food are increasing. That's one thing. And also the vertical transmission of Helicobacter from mother to child, or clouded condition are resolved, and that makes the Helicobacter pylori infection declining very sharply. And indeed, these days, maybe younger than 20 years old, only less than 10% are infected with H. pylori.
And overall, what would be?
Overall, it was previously 67% with our age group. However, after that improvement in the social status, the overall rate declining, and the average rate right now is less than 30%. And also, another important factor of marked reduction of H. pylori is we implemented mass eradication program covered by insurance system. That was started about 4 years ago, I think, 4 or 5 years ago. Then every year, over 1 million people were eradicated. So that further accelerated the reduction.
Could you tell us something about the famous gastric cancer screening programs of Japan? I mean, that you are the masters. Your country has really laid down. That is a remarkable thing.
Yeah.
So can you tell us something about?
Yes. Thank you very much for asking. Because of the very high rate of gastric cancer mortality, government actually initiated mass screening program with double X-ray contrast X-ray program or fluorographic indirect method, and that saved life quite a lot. But these days, people are quite sensitive about radiation exposure, and also people are aging and having more colorectal cancers. That causes some, problems, because barium might solidify in the colon and causes ileus. So people are now afraid of receiving X-ray mass eradication programs, rather than they prefer to be examined by endoscopy. However, endoscopy was sort of painful.
Thank you so much, Professor Kentaro.
Thank you.
Arigato.
Thank you.